A cataract is when the eye's natural lens deteriorates as we get older. Besides that, cataracts can also be caused by other factors like being born with them, certain diseases, or even from using specific medications or substances. But mostly, we focus on cataracts that develop from the natural aging of the lens. Once you reach a certain age, usually around 50 to 60 plus, you'll start to notice cataracts, though they might not affect your vision much yet. But by the time you're 70 to 80, cataracts will definitely start to interfere with your vision. The initial symptoms you'll notice are changes in your vision from the age of about 20 up until around 40. Your prescription tends to be quite stable, but after 40, deterioration begins. The first thing is a decreased ability to see things up close. Simply put, it's a loss of near focus, but the symptoms are similar to long-sightedness. This doesn't affect you much yet, so usually glasses can help. The next stage is as you get older, perhaps around 50 to 60. The lens, besides becoming harder to focus, will also start to become cloudier. This causes the light passing through to light scatter in your page. This means the focal point is no longer consistent, and it reduces the contrast and sharpness of the images you see, especially in the dark or in low light. In some cases, the lens thickens, which can lead to increased short-sightedness. This is another common symptom of cataracts. In the past, cataracts were the leading cause of blindness before surgery became widespread, but luckily this type of blindness is treatable. If it's just cataracts on their own, the lens will get cloudier and cloudier until it reaches a stage we call a mature cataract. You might see in the eyes of very elderly people who haven't had surgery, the centre looks cloudy white. If it's only a cataract condition, we can still fix it with surgery, but if complications from cataracts arise, such as severe inflammation that goes unnoticed and untreated, or if the lens structure thickens to the point where it changes the structures around the eye, causing the drainage system to change or have problems, then glaucoma can follow. Glaucoma is damage to the optic nerve. Even if the lens is replaced with a clear one, your vision might not be as good as it should be. There are several different types of surgery. In the past, surgery involved a large incision and required extensive stitches. With a large incision, there's a higher risk of complications, so it's less safe and requires a longer recovery time. Nowadays, we've made a lot of progress. So the standard method we recommend for cataracts that aren't too hard yet is small incision surgery. We make an incision at the edge of the iris of about 2.4 to 2.75 millimeters. Then we use a tool to break down the cataract using ultrasound waves. After that, we remove the fragments and insert an artificial lens. This method doesn't require any stitches. So the curvature of the cornea won't change much, which makes for a quicker recovery. There's no need to stay in hospital. Normally, breaking down cataracts with high-frequency ultrasound waves is our standard procedure. Patients get two main benefits. First, the cloudiness of the lens is removed from the natural lens. Second, we correct existing vision issues, whether it's short-sightedness, long-sightedness, or astigmatism. We can correct all of these, and in some cases, we can improve vision at various distances as required by the patient. Before surgery, a thorough examination is required to see if the patient has refractive errors, cataract, or any other eye-related conditions. We only recommend surgery when the benefits outweigh the potential risks for the patient. As mentioned, mild cataracts can sometimes be managed with glasses, but if the cataract is advanced and affects daily life, we'll suggest surgery as an option. Alternatively, we can monitor the symptoms depending on the patient's preference. This is because the patient's best interest is our priority. The benefits must outweigh any potential harm, however small the risk. Therefore, we provide accurate information so we can decide on the cataract treatment together. At the Eye Centre of ViMUT Hospital, we have modern, standardised equipment for diagnosis and comprehensive cataract treatment. We also have a multidisciplinary team of specialists for eye care.